We've all been there, right? A slip of the knife in the kitchen, a stumble on the sidewalk, and that moment you look down and see a cut that's just a little too deep? For a lot of us, the next stop is getting stitches. It seems so routine, almost mundane. But there's this fascinating story of biology and incredible precision happening in that simple act.
So let's really get into it, because stitching up a wound is so much more than just closing a gap. It's actually a carefully orchestrated process that helps our body do what it does best: heal itself. We're going to follow the entire journey of a wound, right from the initial break all the way to the final scar.
Okay, first things first. Before we can even talk about how you fix skin, we gotta understand what it is we're actually working with. Because our skin isn't just some simple covering, it's a seriously complex, multi layered organ. This image here gives us a fantastic cross section of our body's first line of defense. Now let's just focus on the two main players you see here. You've got the epidermis right on top, and then the dermis just underneath it.
Think of the epidermis as your personal shield. It's tough, it's waterproof, and get this, it has no blood vessels. So, you know those really shallow scrapes that don't really bleed? That's because they've only damaged this top layer. It's our barrier against pretty much everything. But the second you see blood, well, that means you've hit the dermis. This is the living, bustling city right beneath the surface. It is jam-packed with blood vessels, nerves, and all the collagen fibers that give our skin its strength and elasticity. And when this layer gets broken, that's when a doctor or nurse has to step in.
And that brings us to the big question, because a medical professional doesn't just see a cut. Nope, they see a puzzle that they need to solve before they even think about picking up a needle. They're running through this mental checklist. Was it a clean slice from a kitchen knife or a jagged tear from a fall on gravel? Is there any dirt or glass in there? And here's a really critical one. How old is the wound? A wound that's more than about 6 hours old has a way higher risk of infection, which might mean stitching it closed is actually the worst thing you could do. This really gets to the heart of that decision. So on the left, you have a laceration, a clean cut. That's the perfect candidate for stitches. The whole idea is to bring those clean edges together so they can heal up neatly. That's called healing by primary intention. But on the right, you have an abrasion, a scrape. You've lost that top layer of skin. You can't stitch that. It has to heal from the bottom up, a totally different process called secondary intention.
So, assuming the wound is a good candidate for stitches, the practitioner gets their toolkit ready. And let me tell you, this is not your grandma's sewing kit. This is where medicine becomes a real craft of precision.
We're talking about some serious instruments here. You've got needle holders for absolute control, forceps to gently handle the tissue without crushing it, and the sutures themselves, which are basically marvels of material science.
And not all thread is created equal. Absorbable sutures, they're designed to literally dissolve inside the body over time, perfect for closing up deeper layers of tissue. Then you have non-absorbable ones. They're for the skin surface. They're much stronger, but yeah, you have to go back and get them taken out. The choice of thread is also incredibly specific. I mean, look at this. A really delicate area like your face, that requires a super fine suture, a 600O, to keep scarring to a minimum. But a cut on your leg needs a much thicker, stronger suture, like a 3O. It's totally counterintuitive, but the higher the number, the finer the thread. And it doesn't stop there. Even the needle itself is a specialized tool. Some are designed to just gently part the tissue, while others actually have cutting edges to get through tougher skin. The shape, the type, it's all chosen to cause the least amount of extra damage to the wound. All right, so we've checked out the wound, we've picked our tools. Now comes the art. Let's walk through the most common technique you'll see, the simple interrupted suture. It all kicks off with absolute precision. The needle goes into the skin at a perfect 90-degree angle and a very specific distance from the wound's edge. This makes sure that the stitch has just the right amount of tension to hold everything together perfectly. Then, the needle travels in this smooth curve, dipping down underneath the deepest part of the wound and coming right back up on the other side. The key here, the absolute goal, is symmetry. You have to take an equal bite of tissue on both sides, or else the closure will be uneven. And finally, the suture gets tied off with a special surgical knot. Each stitch is totally separate or interrupted, which is actually a great design because if one happens to break, the others are still there holding the wound together. Now here is the real secret sauce, the true artistry of a good stitch. The entire technique is designed to create something called eversion.
That means the edges of the skin are just slightly turned upwards, creating this tiny little ridge. It looks a little weird at first, but as that wound heals and contracts, that ridge flattens out perfectly, leaving a much finer, way less noticeable scar. It's brilliant.
So the practitioner's job is done. They can put their tools down, but the body's work? Oh, it's just getting started. Those stitches are really just a scaffold. The real magic happens on a cellular level, over weeks and sometimes even months.
Healing isn't just one thing, it's like a 4-act play. First, you have inflammation. That's when the body's first responders rush in. Then comes the destructive stage, where the cleanup crew of white blood cells clears out all the debris. After that is the proliferative stage. This is the rebuilding phase, with new collagen fibers knitting everything back together. And finally, the maturation stage can last up to a whole year as that scar tissue remodels itself and gets stronger.
And what's just incredible is that this fundamental process, whether it's from a paper cut or major surgery, it's universal. Our bodies follow the exact same amazing blueprint for repair every single time. And that brings us full circle. That's the whole point of stitches. They are the tool that lets the body achieve that perfect primary intention healing we talked about earlier. It's all about creating the strongest and most cosmetically clean repair possible by bringing those wound edges together. And to take it even one step further, skilled surgeons will actually plan their incisions to follow the skin's natural tension lines, sometimes called Langer's lines. By cutting parallel to these invisible lines, the wound closes with way less tension, which means they're working with the body's biology to create an even better, fainter scar. So the next time you look at a scar, whether it's yours or someone else's, maybe don't just see it as an imperfection. Instead, try to see it for what it really is. The beautifully stitched together proof of an amazing, intricate, and powerful biological machine that knows exactly how to put itself back together again.